Recurrent pregnancy loss or recurrent miscarriages is a devastating diagnosis for us women across the globe to have. What is recurrent pregnancy loss? Defined as 2 consecutive pregnancy losses globally. However, in this country, we limit the definition of recurrent pregnancy loss to 3 consecutive losses. However, I believe that we need to start investigating after 2 pregnancy losses because, as I mentioned earlier, this has got a devastating effect on the emotions as well as a physical effect on the individual and the couple going through this. There are a lot of risk factors of recurrent pregnancy loss, starting with modifiable risk factors and non-modifiable risk factors. Some of the modifiable risk factors could include alcohol intake, smoking, as well as a body mass index. I have published that a body mass index for us ladies, if the body mass index is more than 30, it does contribute significantly for a risk of pregnancy loss. But non-modifiable factors could include things like thrombophilia, which is an inherent capacity to overclot and underclot, and that is a very important diagnosis. Absolutely, you can have a successful pregnancy naturally even after recurrent pregnancy losses, provided you have had all of the relevant investigations. I'm a firm believer that the couple both need to be investigated. Both the lady and the gentleman need to have investigations in order to optimize natural conception and to result in an ongoing pregnancy. The testing includes a sperm analysis and even a sperm DNA fragmentation test, which evaluates the sperm quality for your partner, but also includes normative plethora of investigations for the lady, which includes a 3D ultrasound scan, a blood test to evaluate about thrombophilia risk, as well as thyroid function tests. And of course, it depends on your consultant whether they would like to further investigate recurrent pregnancy loss by doing a natural killer cell panel. Very debatable, but again, it depends on your individual history and circumstances. So the treatment of recurrent pregnancy losses, one, could be nothing, but actually accentuate your preconceptual health in terms of diet, nutrition, and supplements. Again, reach out to the Aria consultants to talk further. The second option could be actually optimizing your luteal phase. What is the definition of luteal phase? It's the phase that is present after ovulation, which is very important for implantation. So it could just be accentuating or supporting your luteal phase with a little bit of progesterone and maybe aspirin, again, depending on your history, which you would need to discuss with your consultant. The third modality of treatment, and I'm delighted to say that the Australasian College of Gynaecologists have suggested that this may be an option, is to proceed with IVF treatment. Now, everybody is listening will be actually alarmed. IVF treatment, especially for a couple who are trying naturally, it doesn't make sense. But actually, if one of the main reasons for recurrent pregnancy loss is chronic embryo aneuploidy or chromosomal abnormalities, depending on the mother's age or the father's age, then it would make sense to proceed with IVF treatment and genetic screening of embryos in the laboratory rather than our uterus rejecting these chromosomally abnormal embryos, causing physical sequelae to the pregnancy losses.